Good morning, everybody. Today's topic is dual energy CT. Here in this video, I'll be discussing only the principles. In the next video, I'll be discussing applications. The principle is something like first, what is the dual energy? Here, there are different attenuation techniques. One is like there will be two X-ray tubes in from and two detectors. From one X-ray tube, we are giving 80 to 100 kVp. Another one, we are giving 140 to 150 kVp. So this one we get detector A detects low energy photons. This detector detects high energy photons. So there will be different attenuation techniques. In some cases, there will be only single X-ray tube, and it will be shifting. Voltages will be shifting in some seconds. The another will be like the detector. There will be dual detectors. The upper layer may absorb the low energy, and lower layer may absorb the high energy. Another will be there will be filters. So this is like dual energy CT. It utilizes two different X-ray energy spectra. So one is we are giving 80 to 100 kVp, another is 140 to 150 kVp. So it utilizes these two different X-ray energy spectra to acquire image data sets of the same region. Region, it passes through the two different energy spectra. We get two different we get image data sets from this. So this allows differentiation and quantification of the materials. So there will be different materials that have identical HU. So while when these materials they pass through these two different energy spectra, we get different data sets. So by taking these data sets, it allows the differentiation and quantification of the material. So materials, they attenuate low and high energy X-rays. They attenuate low and high energy X-rays differently. So for low energy X-rays, they attenuate differently. For high energy X-rays, they attenuate differently. Based on this in turn is based on their atomic number and density. Remember, this sentence is important. So materials, they attenuate low and high energy X-rays differently based on their FHU, atomic number and density. So coming to principle proper, the core principle is based on the fact that different materials exhibit relatively specific change in the X-ray attenuation at different energy levels. What is this definition? What is X-ray attenuation? So the X-ray beam, when it passes through a material, the intensity of the X-ray beam decreases. So the energy might have absorbed, might have scattered. This is X-ray attenuation. So the core principle is based on the fact that different materials exhibit relatively specific changes in X-ray attenuation at different energy levels. Super. So the principle is like it depends upon attenuation mechanism. Attenuation mechanism is something like photoelectric effect and Kaplan scattering. What is this photoelectric effect and Kaplan scattering? In detail, I'll be discussing in the next video. Here you just remember 2 points. The photoelectric effect and Kaplan scattering is something like when the X-rays are formed right from the X-ray tube, they pass to a material and these processes occur. Photoelectric effect depends on the atomic number, remember, of the material, and it predominates at low energy levels, right? At low energy levels, this process occur. Low energy levels. Then attenuation peaks sharply when the incident photon energy is just above the binding energy of an atom inner K shell electrons. So normally what happened in an atom, this is K shell, right? We have 2 electrons in K shell. From outside we have incident X-rays. So this energy of this photon should be more than the binding energy of this electron. Then only it can remove this electron outside. So the attenuation peaks sharply when the incident photon energy is just above the binding energy of an atom inner shell electron. So this is the KH. Then Kaplan scattering. This effect predominates at the high energy levels and depends largely on the material electron density. Remember, photoelectric effect and Kaplan scattering. It depends upon the atomic number and low energy levels, predominates at low energy levels. This Kaplan scattering predominates at high energy levels and depends largely on the material's electron density. So then material differentiation. Dual energy CT acquiring two data sets, typically at 80 kVp and 140 kVp. By analyzing how attenuation differs between these two spectra, algorithms can solve for the contributions of photoelectric and Kapton effects. So here it depends predominance at low energy levels, this predominance at high energy levels. It depends upon atomic number, and here it depends upon the electron density. This enables the separation of the heavy atoms like iodine, which has an atomic number of 53, and calcium, which has an atomic number of 20, from the soft tissue. So utilizing, then in post processing, what happens, it uses data for material decomposition. It's separating iodine from calcium and generating virtual monoenergetic images which optimize contrast to noise ratios and reduce beam